call it again?
Sound speed?
Okay, good, thank you. All right, go ahead for Slate.
After Eden docu-series, Dr. Jackie, take one.
Everybody clear?
Jackie, if you could,
Everybody settled and comfy? Okay, here we go. Sir, when you're ready.
if you could just, to start with Jackie, give us your name, last name, and what you do.
It's Dr. Jackie Keish. I'm a marriage and family therapist in South Lake, Texas, and I'm a licensed professional counselor.
Jackie, how long have you been working in this field?
Since 2004.
And what drew you to counseling?
It's a great question. I started off being a special ed teacher because in high school and college, a professor came on to me sexually and told me how to keep my grade, which was an A, of course, that I had to keep the A only if I slept with him. And I was so embarrassed, I didn't tell anyone because it was in 1973, and I ran to the dean's office, and there was one dean that was a female, and I told her what happened. I didn't tell her what happened. I said, I need to drop this class. And she said, well, why? And I wouldn't tell her. So I was like the victim, and I was embarrassed. And so then when she finally got it out of me, because I wanted to keep the A that I had and be a clinical psychologist, I finally told her, and she looked at all the grades that I had, and she said, well, you've got a lot of abnormal psych. You got all these classes for kids. You could be a teacher. You could be a special ed teacher. And I walked out of that office as a special ed teacher. And she said my dad would like it because I could stay home with my kids in the summer. So I was a special ed teacher at first. And then finally, I got to go back when I was 43 and get this degree, which is what I'd always wanted to do. It's a long answer.
Good, it's good. Trent, can you move that light from just a little bit so that shadow doesn't fall on our eyeball?
Probably
If
this
you
one.
pull it just this way, sorry Jackie,
Yeah.
just stay, keep rolling, go. Jackie, we're gonna dive into a little bit of history here, and then we're gonna get to some.
Okay, keep looking at
Follow
that
the
camera
light
so
on
we
the
can
glasses.
monitor
It's
the,
okay, but we may now get. Trent, that's not, gonna do it for me. Katie, can we lose the glasses?
Yep.
And then Trent, move the
Or
light.
raise the light up a little higher.
Yeah, but it's not.
no, it's not glasses.
It's not glasses.
It's a shadow up.
It's throwing a shadow from
It's
the
a
glass.
physical
Oh, I see,
reality.
all right.
Yeah. Trent, I'd go even a little more that way.
Yes, sir.
Did we cut?
No, we're still rolling.
Okay.
Guys, good?
Yeah, I think so.
How do you think? How do you feel? Okay. That beautiful blue she has is really absorbs color, though. You can see that.
Okay,
I like
we're gonna do all that again, so let's keep rolling.
Let me check focus now.
All
You okay?
Still speeding?
Right there?
Do you want that
Yeah,
whole
we're still
explanation?
speeding. I'm just checking one thing,
That was
please.
very good. That was really good. Yeah.
It's true.
Very good.
I didn't tell anybody about it until I went back to when I was 42. I never told anyone.
Wow.
Crazy.
Add that to your story, please.
That's that mentality.
Please.
Oh, no worry, no worry. I'll be a dentist.
All right, we're good. We're rolling and everything's clear.
All right, Jackie, we're gonna do this again. We had a nice trial run. Please tell us your name, your last name, and what you do.
My name is Dr. Jackie Keish. I'm a marriage and family therapist and a licensed professional counselor in South Lake, Texas. And I've been doing this since 2004.
Jackie, I understand you specialize or focus on some neurobehavior.
Right.
Tell me a little bit about that.
I'm also a neurofeedback therapist, which I work with a lot of people with dysregulation, which would be like depression, hyperactivity, ADHD, anxiety mostly, and some sleep issues. Neurofeedback does other things, but those are really my specialty with calming the brain.
Okay. Calming the brain. What does a traumatic sexual experience do to the brain?
It's a great question. It overstimulates, especially if a child has had a traumatic event, a sexual traumatic event. It changes the brain. It's a neurodevelopmental change. It overstimulates the amygdala, the hypothalamus, and it's an access area that is at that time forever changed. A child will go, and even if they grow up and go into counseling, they will still overreact and go into stress much faster than just a normal person would do. They actually go into fight and flight, faint and flag, they call it, because they cannot really comprehend what's happening. So the brain is forever changed for them, for children that have had this traumatic event sexually. When I work with people that have had trauma, I do a placement for just that, for the amygdala, to help calm that down. And we also do, with working with that, I would help some children or adults with breathing techniques, mindfulness activities, prayer, of course, if they would choose to do that, music therapy, anything to help them calm the amygdala, the part of their brain where they can then access their frontal lobe, where they can make better decisions. It's like a firestorm in the brain for anxiety and stress. And that's what happens when you've had an early trauma.
Early trauma versus early sexual trauma, is there a difference in the chemical reaction?
Mm-hmm.
In early trauma, such as houses on fire, and you're in the house,
Right.
or a robbery, versus a sexual violation, is there a difference in the brain?
There would be a difference in the fact that it would not be as, the longevity would be much shorter. So the damage would be shorter. I've actually worked with kids that have been in car wrecks, and we've had problems with insomnia, having problems with nighttime, what do they call it? Nocturnal enuresis, nocturnal encopresis, to try to, the child will have that happen after a trauma. But with sexual trauma, it's much more elongated and much more damage is done than just the short traumas. So if you can imagine a short trauma causing a child to have these developmental problems, going backwards with their bathroom habits at night, or sleeping, horrible dreams, that is times 20 or more with a child that's actually had a sexual trauma. And if it's elongated trauma, then it's much worse. I've had people ask me, is it possible for them to ever get over that? And I think the research is still out there, because as younger children are getting more and more involved or thrown into the sex trade and abused, I'm not sure what's going to happen, to be honest with you. I don't think anyone knows the answer to that. It's tragic.
Well, if I say imprinting, and what I mean by imprinting is that first sexual experience, right? Now, chemically in the brain, you say it's there.
Mm-hmm.
What does that do to the understanding from a child of what love is? Your perspective.
I think you have to teach love after that, because I think the brain is like a firestorm. It's just fight or flight, it's existence. And they don't really have a self-worth. They don't really understand themselves as autonomous. So after that, you have to first teach them to love themselves and understand they have value as a human before they can really even accept what love would be with another human, is my opinion, how you would work with that, because it's so damaged at that point.
Jackie, and can okay. Yeah, hold on a second, Jackie. I wouldn't drop.
Well, drop a little.
Just swivel to your left. Just pull some of that floor out.
And then I've got, what is that spot over there on your side? White silver looking.
Can you go hide that?
I got it.
It's a piece of carpet, you just throw the black over it.
I can move my hands.
Yeah.
Drop
Do
down.
whatever you think you can do,
Slightly, if you don't mind.
yeah.
Do this. and
There?
this.
Yeah.
And you're gonna pitch up.
Yeah, I
Yeah.
probably just need,
There?
yeah, well.
Here you go. And you can pitch up at her a little bit.
Okay.
A little bit of.
All right, thank you. 1 second. Let's get the dark side.
Okay. Just check the focus.
Yeah. All right, hold on.
Are we cut?
No, we're still rolling. It's part of my screw on my All right, I think we're,
Okay.
you like angle, okay?
Yep, I like it.
Okay, sorry about that, guys, just want to make sure it was
No
good.
problem. Focus, good, yeah.
Yeah, okay.
Jackie, these oppressors, these perpetrators, these ones who actually abuse children, your opinion, how do they get there? Because there's obviously a different kind of a brain chemistry going on to justify hurting another human being, particularly as it relates to sex. We can talk about school shootings and things in a different, but in sexual abuse, what is going on in that individual's mind and where does it come from?
Pedophiles, even though I think a lot of these people we're talking about are really just greedy and for the finances, and probably psychopaths that really don't have feelings of empathy toward other human beings. That would be my thought with some of the greed that we see and the money, because it's such a huge moneymaker, sadly. Pedophiles, they say, come from that they have been abused or they've seen abuse in their family, and sometimes it's a familial thing. But with some of these younger people that we see out, I've seen the other day, there was a woman, I thought, how could a woman do this, really? And it has to be about the money. They can't all be psychopaths, can they? It has to be about the money.
Does therapy intervention last? If someone goes through therapy, is it lasting? Is that change, can it be lasting? Because if that imprinting, that sexual experience is lasting so long, what does a reset look like? And is it possible?
Are you talking about a young child or just anyone?
Someone who's a victim that's now a survivor, can they rehabilitate from that trauma, not physical, but the emotional
Right,
trauma
sure.
and the mental trauma?
It really varies about how long, the age that they went into this slavery, what their relationship was with their family before. You know, some people that have a great relationship before, they weren't in it for a very long time, can really do okay. They can come out of it. They will have trust issues, of course. They'll have paranoia for a while. They'll be able to have to do some therapy, so it would be a shorter term therapy for them. But when we see these younger people that are going in and staying for some time, having these people come out it'd be a long-term therapy with different types of therapies. Like some of the therapies that we use are trauma-based therapies, such as EMDR, which you've probably heard of, eye movement desensitization and reprocessing, which I do, which is a great therapy. Some cognitive restructuring, even some of the ones they do profound. You have to face everything that happened. It's a very stressful type of therapy. But there's such a fragmented mind from these people that have been drugged, and they'll be out of it, and then they'll wake up and they'll have a horrible thing happen, and then they'll go back into a drug state. So they have fragmented memories, and these can come out with what we call intrusions or flashbacks. And when that happens, they don't have a context for it. So that type of therapy can go on for a long time, because they may do great for a while after some of the different therapies have been accomplished with them. But then they'll have one flag or a signal or a smell or a song that can just trigger them again. So honestly, I would probably say long-term therapy for most of these people.
Jackie, we're in a world where there's so much going on about gender, right? Gender fluidity, gender confusion, cross-gender, all these kind of things. Is there any correlation between that from an identity standpoint and early sexual exposure?
I wouldn't really say that I believe that as much. I think that's more of a fad thing that's happening. I think just the devaluation of women and females in our world. Sadly, I think the early sexualization of our young girls is the big thing for it. And then we've got our celebrities that little girls look up to. And then we have this huge hurriedness for our children to grow up and to shave their legs and to do their nails and to grow up too quickly. And then we've got the internet, which is the worst thing out there, really, for this type of issue. It's a blessing, and it's the biggest curse I think we really had. So as parents, we really have to stop the internet exposure to these children. The question that you asked a minute ago about the men, how did they get this way? It's such a great question. I do know porn addiction or compulsion, they're calling it. They're not really calling it addiction, but it does have the same characteristics of addiction. Have had children before that are 12 and 13-year-old boys that are basically addicted to porn. And computers are everywhere. And I've not been successful. I sent them to a specialist. And I just don't know if people really ever can get over that because of the way it stimulates the brain. It gives it a rush of excitement because the weirder, the more bizarre the porn that they see, it's like it has to be worse and more exciting or more taboo the next time you see it. And with the computers being so available, it's really almost impossible to keep them from getting into a social media, a phone, iPad. And parents are really using these a lot as babysitters. So I had a boy in my office one day, he was looking at porn, I didn't even know it, because you really can't tell. And I've heard of men babysitting their children looking at porn. Now, they've never bothered their children or touched their children, but they're still addicted to that thrill that they get from looking at the different types of porn that are out there. A lot of divorces, of course, have happened because of that as well, and jobs lost. It's really there really needs to be a solution for this, and I'm not sure what it is.
Jackie, in your understanding, for someone to change, we're not talking about changing habits. We're talking about deep-rooted change here, such as going from being a porn addict, a drug addict, an alcoholic, which seems to be, to me, coping mechanisms. Are there deeper rooted issues? And what does it take for someone to change? Other than just, okay, it's therapy, but can they change? I mean, because we're talking about how to deal with these people in society, and do you release them back to society after 3 years in jail? Or 60 days in jail? You know, can someone change? Can a John that pays for sex with a child, that goes to jail for 60 days, can he change in 60 days?
No. I just read some research the other day, and they were saying, we used to say all pedophiles will never change, and there's just no solution at all. And keeping them in jail is probably the best thing, but our jails are full, so they let them go. One of the researchers that I saw said that they had a recidivism rate of 6% of ever offending again, which is the first time I've ever heard anyone say anything positive that these people could really change. It's been my experience that they can't, but there's new research coming out. I know there's no new therapies coming out, though, that are changing this. So I don't know what's happening unless there's a deep core change in the person's spirituality that gives him some empowerment and strength to be able to fight this compulsion or addiction, whatever word we want to use. It has to be more than just talk therapy, I think, and some of the things that we can do in the office.
In your opinion, when you decriminalize something like the attempt to decriminalize prostitution now, by just decriminalizing prostitution, is that going to create some societal change in people's behavior? I mean, what is your thoughts about that psychologically?
Yeah, I heard about the lady that Camilla Harris in California wanted to make, sort of like the Netherlands, like Amsterdam, wanted to have that so that we would get rid of some of this rape and trafficking for our children. But I don't know that that's the answer, because my understanding is some of these rapes with our children, it's like $25 is all that might cost them, up to $50. And I don't know, I think there's a weird thing going on about the attraction to small children. I've asked a lot of people about this, and I really can't wrap my head around what that attraction would be, unless it's just that we dress them up like adults and we sexualize them. The music that they listen to is really inappropriate for their age, their understanding, for their brain to even wrap around and understand what they're singing. It would have to be that, I would assume, that we're all a part of that problem. And dressing them up to, there's a dance group that I won't mention the name, of course, but the outfits that they have the girls dancing in are unbelievable. They're stripper outfits. And all of the wonderful people have their daughters dancing in this dance group, wearing horrific clothing. And they're 12, 13, and 14. And I mentioned something to one of the moms, and I said, wow, and it was like, oh, everybody does it. So I think that's what has to change, is our culture thinking this is all right. Of course, I was raised watching Shirley Temple, and she was dancing, tap dancing, but she had on socks and a little dress and curly hair. And it's not like that anymore. So I think our culture has really gone down a road. I'm not sure if we can pull back, but we have to do something about it.
Jackie, if we can just get into, I'd love to just talk a little bit about developmental stages of the brain. Okay? And give me some markers. By what age is a child ready for certain things? And then I'm going to give you some things according to you. By when is a child ready? And of course, it's not every child, but developmentally. Because you're saying we're accelerating some of these things.
Right.
So by when should a child be ready to have a conversation about what sex is? Not traumatized sex, just what sex is. By when do you, that number one, and by when do you think a child is ready to engage, or a human being to engage in a meaningful, deep relationship? A committed, hopefully not codependent, but a committed relationship. What are some of those markers to give us guide as to say, okay, if it's 9, but we're doing it at 7, just give me some guidelines of what some, and it may be other things that I didn't ask, but give me some of these markers to set a baseline for us.
Right. There was a wonderful research that came out years ago about a study that was done with children. And basically, at 12, they no longer give a lot of value to what the parents will say, that their peer group is more influential with their decision-making than mom and dad. I thought that was wow, but I really believe that's the truth. At 12, if you haven't done good parenting before 12, it's a little harder after 12. I would say before 12, you're really teaching the child to love themselves, to take care of their own body, and to what love feels like in a normal, healthy family. And protecting themselves and wearing clothing for their private parts and having respect. I think at 11 and 12 now is when we're having the talk, so to speak, about relationships. It still sounds early, but they're getting it on the streets apparently at 12, and maybe even earlier now. I would say a deep committed relationship like you're talking about, where our brain doesn't really completely develop until 26. So that's older than we would think, but supposedly your frontal lobes, where your decision-making happens, your executive branch, your executive functioning of your brain happens where you see consequences for your behavior, is in your mid-20s. So I would think for a long-term committed relationship, it would be around that time to really make that commitment for a lifelong relationship. But I think at 17 and 18, and I heard the other day someone's trying to make that the voting age. That would be a nightmare to have these children voting at 17, 18, even though we're sending them off to war at 18. And I think that's really too young to be sending people off to war at 18 years old.
So Jack, with that then, if you're saying mid-20s, brain is fully developed, and I've heard that, men 28, women 26, then surely sexual, or let me ask you this question. The act of sex, from a chemistry standpoint, is it deeper than just an act? Is there more going on, spiritually, physiologically, other than just the act in the sexual organs? Is there an actual other connection?
Well, it's interesting how you're asking that question. If you have a shock to your system, you've probably seen these pictures. If you have a shock to your system, if you're in a relationship and there's an unwanted advancement or a rape or attempted rape, the brain actually shows, if you've seen some of the colorations, will go to the happy area, and then there'll be a shock to the system, like we see when we take cocaine. That's a very happy feeling. You're having an ecstasy moment, but it goes from that when, let's say that you're with your boyfriend or girlfriend at the 17, 18, 19-year-old range. It goes from that to the shock area, which is more of a fight or flight. And what I've had many girls tell me that they just didn't even care. They just wanted to do it so they wouldn't be a virgin. They just thought they needed to do it before they graduated from high school. That was sort of the rule. And this is at a very nice high school. This isn't a terrible area of town. And I said, well, tell me what that was about. Didn't you want that to be special? No, I just need to get it off my plate. So that's our culture. And she did have sex and she didn't care about it. And then she was very sad and came in my office and was just sobbing. And I said, well, if you could do it over, what would you do? I wouldn't listen to what everyone says. Sounds great, but that's that consequences of behavior. Their brain is not really developed until the mid-20s to really understand that this is going to affect me for life. This one decision that I made is going to really have an after effect. But at that moment, she listened to her peers, which is really their biggest strong touch base that they ever really want to be popular. They want everyone to like them. So they really want to do what everyone else is doing. And not to do that puts you in some jeopardy.
Jackie, can you break the human spirit?
Absolutely. I think you can.
Talk about that a little bit.
Some of the people that I've seen that have been in the sex trade, I really feel have been completely broken. I've seen some that are just have had the worst case ever and have this. She actually corrected me. I loved it. She was alive, and I said, so you are survival. You're a survivor. And she said, no, I'm a thriver. And this was probably the most horrific situation ever. So some other people have been broken, but I would say she's the biggest thriver I've ever seen. So I think it's variable. Some of us can be broken and some can't. And if anybody would have, her situation would have been the worst. But she corrected me when I said, you're a survivor. She said, I'm a thriver.
So Jackie, talking about trauma on trauma, and what I mean by that is you're in neurobehavior, PTSD, these kind of things. What happens to a human being psychologically when it's repeated trauma, but not the same trauma? So it's verbal abuse, as we see in sex trafficking, physical abuse, and then repeated rape, but also emotional abuse. So when it's compounded trauma on trauma, but it's
Right.
like an avalanche.
Right.
How does that affect the brain, and how do you come back from that?
The only way for that person to survive is sort of a blessing, but a curse. It's a dissociative detachment. When they're having so many multiple traumas, they don't have the ability to make sense of anything. When their body is being abused in a horrible way and they feel pain, and if they're not doing things just right, they get cut or cigarettes are put out in their skin, and they have to really disconnect from their body to be able to survive. It's a beautiful thing, but it's a horrible thing because this is the only way they can survive, because there's constant trauma, constant fear of death, constant fear of losing everything that you've ever experienced. And some people say, I wanted to die, but then they didn't really want to die, talking about the human spirit. And I said, well, they said there was no way to kill themselves there, and they would pray for death. But the other ones that I've talked to have disassociated. And it's sort of the brain's way, I think, to help you stop the fragmenting that happens in your brain when you have trauma. You have a moment of a horrific moment going on that's happened to your body, and you have to pass out or you have to disconnect and come back to that fragmented moment again. But if you can learn to really disassociate and detach, I've been told that that's the only way to survive it. The problem with that, of course, is when you do get out, hopefully, and you do try to regain and get into a civilized world, that you are actually having trouble not to do that all the time, that you disassociate with everyone. You go into what we talked about, the fight or flight, or the flag and faint when there's a trauma, because there's this whirlwind of electrical sparking in your brain that you can't make sense of anything, so you'll pass out or you'll run or you'll fight. That saved them at one place, but it really turns out to be very impossible, or takes a lot of work to reconnect, to get your brain to go back to where it needs to be. It's never going to be the same, but this is where cognitive behavioral techniques will come into play, to learn to go back and re-traumatize to a degree, but also learn to decompress, how to do the breathing, some of the self-soothing techniques, and to realize the most important thing is that it was never your fault, that you were never in control, that everything was beyond your control. And once that they can accept that and understand that they'll be able to make sense of their world again. And then we have to start with this connecting relationships with people, because there's a lot of paranoia after the brain has been so traumatized for such a long time. And with repeated, like you said, not just not sexually, but physically harmed and burned and cut. And with the emotional as well, the words and the horrible things that I've said to them. So for them to ever get out of that mindset, it's really a relearning that when something happens, when they're out and they're in with group work, which is really very helpful for a lot of these people, that they're able to sit and feel about their feelings. How do I feel about what just happened? Because they were never, ever able to express feelings before when they were in the slavery. Their feelings didn't matter. They couldn't say anything about not to do this to their body. They had no personhood. And so now we're trying to get them out to understand that they are valuable, that they have a human spirit, and they have to learn to feel what that's about before they fight and flight or pass out. It's really a very interesting phenomenon. I'm not sure that we've ever had anything like this before. And
I mean, what, not just in sex trafficking, but what have you experienced with some of your patients justifying bad behavior? What goes on in that individual's mind?
for them, you mean justifying?
Yeah, when they justify bad behavior.
When they were in the slavery?
And it may not just be sex trafficking, anything you deal with. Someone who is in your office and you're recognizing that there's repeated bad behavior, but they're justifying it, because we're seeing that in trafficking a lot.
Oh.
Yeah. And in general, what is that psychosis?
It's a good question. I haven't really seen them justifying bad behavior, so I'm trying to understand your question. I have a lady once that was in a group work, which I love group work, with these people, and someone was trying to justify, tried to go back and tried to be her own pimp because she didn't really want to go out and get a job, or that was what she was comfortable doing. So she wanted to go back and to be a prostitute. And a lot of the women in the group were furious with her and were trying to help her not be codependent upon the sex trade. And, you know, trying to put those words out. Why don't you want to do this? We can do this. We can get a house together. We can have a different life. And that was all she really wanted or needed or thought she could do. So I think that they lost that lady to go back into that herself, said she would be her own pimp.
Is codependency
codependency.
Is codependency always prevalent with an oppressor?
Yes.
Does the victim become codependent
Right.
by default? Is that
Sure.
part of the training, almost making them
Right.
codependent?
Right. That's when we see this online all the time. You're talking earlier about the online, how easy it is for people to be picked up online because they're being flirted with, they're being told they're beautiful, they're being told how sexy they are at 15. I thought you were 30. You know, and so a lot of these young girls are falling for that because they're not getting attention for whatever reason. So it's a codependent relationship for sure. And once they get in, and once, God forbid, horrible things start to happen to them, then some of them still believe that that person that brought them in cares for them. So that's a very unusual and very hardcore, codependent, delusional situation. But most people that I've read about will get in and they'll realize what happened, and then they're trying to get out, or they're drugged all the time. But then these people that get out have actually knew of someone who got out, had gotten in from her boyfriend, got her into the trade, and she was able to escape as a miracle. And she had such hate and revenge that was really what was eating her up, more than what happened to her in the trade. So I think it's very different for everybody, to be honest with you. But there is a codependency that your opinion matters more than my opinion of myself. What you do to my body matters more because I want to please you than what I really want to accept to happen to my body. So that would be the codependent piece, that you matter more than I matter. And that's what we have to work when people come out of this. We have to teach them that they have to find their voice, that they get to have an opinion, that they get to say, no, I don't want to do this. And they won't be abused in the real world when that happens. That's the hard part, when we're having to re-socialize people to get them to be able to use their words and their emotions and to feel what's going on in their body, because they've been so detached from their body in the trade.
In some of your sessions, how do you define success with a client? What is success?
It's a great question. You know, I would say as a mother, I'd say, well, they can take care of themselves, but I would honestly say for them to finally be happy and to feel self-worth. Now, we think that's what I care about as a therapist, but then we also want to get them into something where they can get more pride and more self-esteem, more empowerment by learning a trade and take care of themselves. But for me, at the level where I work with people, it would really be for them to have some joy, just some joy,
Jackie,
some
talk
laughter.
about techniques versus chemically induced progress.
Well, there's a lot out there, and medication is used for some. MAOIs, some barbiturates. That's not my field, but some medications are okay for like stress and anxiety, depression, because that's something that follows them a lot. But that's why I use the neurofeedback, because a lot of people don't want to use medicines or they don't work for them. And neurofeedback helps regulate the brain. The brain that has been so traumatized really needs to learn a way to self-soothe. So that's what I mentioned earlier. It would be the meditation, prayer, music therapy. I've done art therapy, which is a lot of fun. But the neurofeedback, there's a protocol for mindfulness. It's really a great protocol. It's really for sleep and calming the brain, the amygdala. So it was actually devised. They brought some monks over, I believe, from India, and they looked at their brain, said, we want you to meditate, we want to see what it looks like. So they hooked them up with the sensors, and they saw that when they meditated, the brain was in this certain range of functioning. And they thought, well, if we can really write a program to have that happen, then we can teach the Westerners who don't have time to learn to meditate like they did, we can learn a way to get our brains to get in that same brain wave. It's called the alpha-theta approach. The brain to be in alpha and theta. Theta is right before sleep, where you're just like this, really relaxed. Alpha is the prayer state. So we're trying to teach the brain to get to that area. And so they're listening to sounds, ocean sounds, some other sounds, and all there's to do when they're doing that protocol is to sit in the chair and to really relax. And I might do some visualization with them. I might be doing some of that. We might do some kind of hypnotherapy along with that. And once they get the brain working in that relaxed area between alpha and theta, then they will be able to reteach their brain what it feels like to be relaxed. So it's kind of it's neurofeedback. There's a feedback, but it's also them seeing what it looks like. So I might say, your brain, you're thinking too much. See if you can do this. And so then they'll hear, when they get in that right range, the machine makes a certain noise that we're aiming for. And so when they can do that, the longer they do it, they're teaching their brain to relax and meditate, which I think is wonderful, especially for this population.
Alpha, theta, are there other levels like that where certain other things get taught? So for instance, if we want to teach someone to overcome fear, do you do that in the alpha theta stage?
That would be
Or
alpha theta.
Is it done somewhere else? Can you tell me about some of these other ranges and where
Right.
do you induce therapy in a acceptable state of mind?
Sure. I would say for fear, it would be the alpha theta range, because we're trying to bring the brain, to relax the brain, to bring it down to a state where your frontal lobe can work. When you're in trauma, you're in fight or flight. And that's high, that's 18 to 36 cycles per second. Your brain is looking, it's fight or flight. It's, a lot of people live there. It's not a good place to live. What we're trying to do when I do neurofeedback for attention deficit, we do work on the frontal lobe, which is the executive functioning, to get them to use their frontal lobe more. Attention deficit issues, usually we don't have a lot of blood flow in the frontal lobe, is why doctors will give us speed or some blood thinners to make the blood go to the frontal lobe, because this is where the executive functioning, seeing consequences for behavior, seeing if I think through this, like the girl I talked about with the sexual date. Had she thought through it more, but she was in that moment, I just have to get this done so I'll be like everyone else. And then after it was done, she really thought about what she had done and really had a lot of shame and sadness. So that was work in the frontal lobe with her.
So fear is alpha theta as well. What kids dealt with in a different range?
If you've got high anxiety, for instance, like I was saying, fight or flight, and it depends on the different areas of the brain where we see that. You move the sensors around to different areas, and it would depend on the side of the area of the brain. Some conditions have high functioning for autism, for instance, has a irregularity of functioning in the brain. So when there's an area that is overshooting, it shouldn't be as high as it is, we put the sensors there. Or if it's, let's say you have anxiety disorder or you have rage disorder. So we have a certain area we put the sensors on because this is what we've been taught. I'm not a neurologist. We put it there, and so we say this area of the brain is overworking. It shouldn't be working this high. And so I'm going to tell them, how do we get it to calm down? So I'm going to give them the ideas, like I talked about, the breathing, visualization, singing, just to bring the brain down. But then they're going to see on the screen, my favorite game has 3 rockets. And I said the yellow rocket is the one that's anxiety. And they can see that rocket is going way too fast. So their job is to bring it down. So it's really a teaching device. I love it. How do you get the yellow rocket to come back? Because the yellow rocket is rage or anger in a certain area of your brain, because this is where I put the sensors. So you've got to get that down because we have to have another rocket going forward, which is calm and focus. So they sit there the whole time and they might get madder, which makes it go faster. So I'll say, take a deep breath, think about this. And so all of a sudden they have control over that part of their brain, which is validating. It's wonderful. And then they'll start to do some of the things to bring the yellow rocket back and the blue rocket forward. And so they're really learning how their brain works. And so that's okay. When you had the yellow rocket going forward and you were really mad, what were your hands doing? Usually this, right? How were you breathing? Short, shallow breaths. So they're learning about their body, and they're learning how to get the yellow rocket or to get the anxiety or the anger. It all looks the same on my machine. Anxiety and anger are doing the same thing. It's too much of a flood, like we talked about what happens with some of these people that are traded. The same thing, the brain is going, it's not even making sense. It's firing. And so they've got to bring that down. I've had some grown men that have had some trouble, and we've done rage disorder work with them using neurofeedback. It's really a wonderful thing. The thing that's so great, they're learning how they're seeing their brain up on the screen, and they've got 3 things that we're looking at. I said, does this look right? And I said, the blue rocket needs to go forward because that's dominant SMR beta, 12 to 16 cycles per second, means that your brain it's going to be functioning in its best place. You make better decisions there across the board. So their job at that point is to get it to happen. And I'm giving them ideas to have that to happen for them so they can experience it. And once we do it, then hopefully we do it 10 times, 15 times, and then they practice these things when they're at their job, when they're angry.
But it's an ongoing thing because a trigger, a smell, a sight, a touch
Well, with a
can throw them back.
right, because of the way that the trauma memory has been stored in our brain is different than other memories, and because it's fragmented. It's like a broken piece of glass. And you might think you work on this one and everything is great for a while, and then one thing happens and they're sort of back, in the fetal position, or they're running out the store, or they're faint. I had one faint. She just passed out because she smelled an odor that reminded her of that. So that's the long-term part that we talk about.